Drilling companies say some chemicals used in fracking a well are trade secrets, and revealing them would cost a competitive edge. But doctors say they need that info when treating someone exposed to them.
Once we get that, we can use that information to treat and diagnose the patient, and we can also report that information to public health officials.
One part of Senate Bill 315 put a gag rule on doctors, blocking them from giving out chemical info, but that all changed late last night after the Ohio State Medical Association protested, claiming it put doctors in a terrible position when it came to patient care.
It really could have restricted the ability of physicians to appropriately notify public health agencies about an outbreak of diseases or medical conditions that cause a public health concern.
Rick Solly with the National Resources Defense Council says the changes made don't go far enough because doctors will still feel the threat of civil lawsuits from the drilling companies.
There's no good that's going to come about for the public health putting our medical people in that type of a conflict.
Solly says there's also a big loophole in chemical disclosure in this bill because the drilling companies get to decide what chemical is a trade secret.
This is the loophole that swallows up the entire rule of chemical disclosure. It was bad in the initial bill, it got worse when passed by the Senate, and it got dramatically worse yesterday in the House Public Utilities Committee.
The Ohio Shale Consortium says Ohioans should feel a level of comfort that the industry is being properly regulated to safety and health standards. And the Ohio Department of Natural Resources says the rules are among the toughest in the nation. In Columbus, Rick Reitzel, NBC4.